If you are participating in Tech Week, you can get free co-working all day today, so please stay after the program, have some more coffee, network, talk to the presenters, talk to each other. So excited to have you guys here. We are here every Wednesday from 9 to 10 a.m. My name is Lauren Finnegan, and I am here, one of your coordinators, along with Christy, Matt, Lindsay, Andrew. We have everybody here today. So thankful to have you guys. If you have not been to 1 Million Cups before, we are an educational program produced by the Kauffman Foundation, here to connect, engage, educate local entrepreneurs while helping build startups on a grassroots level. We're going to have 3 presenters today. They'll each get 6 minutes to pitch and then 10 minutes for Q&A and feedback. So we do encourage you to raise your hand high. We'll have a microphone passed around that we can ask your questions. Yep, since we are filming today, so we do want to hear you guys. We cannot do this without our amazing vendors, so big thank you to Knkt'd for always providing the delicious treats. It smells awesome in here. And then a big thank you to House of Genius for supplying the coffee and keeping us caffeinated. Always need some of that. All right, well, we do have an awesome tradition here of standing up and giving a warm welcome with applause. So we have our first presenter. Everybody, please do it. Stand up and welcome Rachel.
My name is Rachel Kaur, and I'm the founder of Productable Us. So typically when you start a business, you have a million different directions you have to go, and you're thinking about your marketing, your sales, your packaging, all these different pieces, finance, and they're all over the place. It's hard to get a single direction. Well, Productable Us, we have it down to traction, agility, and innovation. So the last 2 years, I worked for Mark Cuban, and I helped the Shark Tank companies after they were on TV. It was a lot of fun. And so he had a lot of unique strategies and processes that he used to get everybody going and running. So we saw a lot of challenges across the 70 companies. First of all, there's a lot of siloed vision, even with an individual company. So you could have 3 people there, but they'd still kind of be running 3 different directions. A lot of limited resources. So when you have, a small company and you're just starting and you want some help, it's basically like luck of the draw with a contractor, or if you try to get some big fish company to try and work with you, you don't have that much leverage, and it's difficult to get anyone to really pay attention to you and really want to work with you. And then entrepreneurs also don't know what they're missing, and sometimes they put their effort in the wrong places. So if they're really good at sales, then they focus on, I have like all this sales, all this room to grow in sales, and they might not realize what they're missing in user experience, or in other places that they're less aware about. So my background's in product development, going from idea to product, and also not just going idea to product, but the methods and processes that are used to create products. So my research area at school was, how do you actually make this process as efficient as possible? So when you design a car, or a drill, or a computer, you actually use the same process no matter which of these you're designing. It goes through the same ideation, prototyping, execution phases, and there's a lot of different companies that specialize in this, such as IDEO, Lunar, Frog Design. Maybe you guys have heard of these before. So the idea here is that we have the product model. When working with, whether it's a CTO, CFO, a programmer, a designer, we found that using the word product is helpful to everybody, and that they're all able to focus around this concept. So using traction, agility, and innovation to talk about product, then we're able to move the company forward. So these are our 3 focuses. So as we help companies, we have an approach of using a research process with incremental improvement. We hypothesize, measure, analyze, test, and hypothesize, measure, test, and analyze. And we always drive our metrics with people, so thinking about what people want to do, what their capabilities are, what their timelines are like, value, are we creating features, functions, things that people want in a way that's valuable, and then money is how's the cost, the ROI, and viability look. So looking at our 3 different places that we help companies, traction's the first one. So this is looking at, does your customer, do your stakeholders understand your product, and is it getting to market well? So an example of this that we did was with Chipotle, a Shark Tank company. And what they have is, this is their first version of their Cricket protein bar. Has anyone tried a Cricket protein bar before? Oh, we got a few hands, all right. So with Cricket protein bars, they had pictures of insects all over their bars. They're not so exciting looking, they're kind of dull colors, not so interesting to the client, so or to the customer. So we thought about who was really interested in bars, and who would try these, what are they looking for, and then we turned it into something a lot more vibrant. So we created something that was more artisan looking, more about more crafted, looks like an experience, where the crickets aren't in your face as much, they're kind of a little bit more tiny. So it makes it a little bit easier to think about and willing to try something new. Another area we work is agility. So this is helping companies with their operations, resources, project management, and strategy. As you can see here, there's a lot of different charts, lots of different stakeholder mapping. This is getting your company to run as fast as possible. So an example here is with Power Practical. We worked with them, and so here in the first corner, each person on their team talks about what they do every day, what their tasks are like. And then in the next one, we put together what the whole team's tasks look like as a team. Then we highlighted with the pink sticky notes, as you can see here, where there were problems, what was working, what really needed to be fixed. And then we created a project management system so that everybody could work together more efficiently and as best as possible. So this was a pretty new startup. There were 7 people on the team, but we found lots of room to help them communicate and work better, even though they were just starting. And then the last area is innovation. So this is doing product development, project management, and planning your go-to-market strategy. So for an example here with Lalaware, they started off with this cup. This was their first prototype in the left corner. And then they moved into something that we wanted to create more aesthetically pleasing. So Lalaware is an edible cup. It's biodegradable, as they like to call it. And so here you can see this is kind of the engineered version on the left-hand side. And then on the right-hand side, we worked really hard with tooling and making it so that it could be manufacturable to create a more beautiful pattern that would be more interesting to look at and a more delicious colors as well. And then they're flavored, not just colors. And then also working with crowdfunding too, so we can take your company from idea, but also all the way through crowdfunding. And this is an example here with Power Practical, taking the Pronto from just an idea all the way to market. 15 seconds. Thank you.
Awesome. We're going to open up the floor for questions and feedback. We are filming for our YouTube channel, so please wait for the wireless microphone to come to you and raise your hand high.
Hey, good morning. Nice presentation. It went a little fast, and I might have missed it, but can you tell me more about the company? Who's in it? What's your structure? What's your revenue model? A little bit about that, please.
Sure. So it's all very early stages. Right now, technically, it's me at the company, but there's a lot of strategic partnerships that I built over the last 2 years and even before working for Mark. So it's a lot of strategic partners, and then as we get our clients and build, then there'll be more of an internal team coming.
That's you alone.
But it's basically, it's a wide network, but yes.
Any other questions or feedback?
I like your presentation. I see that what you're doing is also applies to your own company as you're starting it. Everything that you have there applies to you as well.
Yes.
Yeah. So
The shoemaker has no shoes.
Exactly. And in terms of scalability, I mean, we stick the ball in front of people. So that's all I have. Not really a question.
Oh, sorry.
No, it's not really a question. It was just saying. It's just feedback. That's cool.
There's more growth plans, but we'll save that for another day.
Yeah.
Yes, my name is Tom Hazelton. Do you have a process of charging for your services? Have you identified a
Sure. Yeah, and it's all kind of in testing right now. So it's going to be, I have what I'm calling a bootstrap model, which is, you're just starting off, and so that's a little bit more of quick meetings, you run with it, and very limited interactions, just basically enough to get by, all the way up to essentially working like a partial employee from me or someone on my network who's working with you on a weekly basis. And so those get structured into monthly payments, as opposed to the bootstrap model is probably more like each time it happens.
More questions and feedback? Yes.
Yeah, so based on that, I do think that was what was missing, was you told us a lot about what you could do versus the business model. And so I had a hard time understanding what the business is and how we could engage you or who's your target and things like that. So you might want to consider rolling that in a little less on all the stuff you do and sort of summarize that a bit.
Perfect, thank you so much.
Oh, in the back.
I think this is an important part of 1 Million Cups. How can we help you? What can we do for you?
You're, as an audience,
Yeah, what are you
As a
looking
community-
for from us? Like, why are you here today?
oh, so
Do you
I'm looking to
want
work
us
with
to hire you?
startups. I'm really excited about the community. Working with as many as possible is gonna help me be able to scale my business and then in return be able to help more companies. And so it's really just finding the right people to work with and build something together so that we can build startups that are successful here in Dallas and really create a network of all of the resources. I've lived in a lot of places, New York, San Francisco, Chicago, Austin, Singapore, Beijing, and a lot of them have very easier networks to navigate. And I'm not saying that it's all easily there, but a lot of times when you're starting something, you spend a lot of time looking as opposed to doing and just trying to figure out how to solve your problems as opposed to actually solving them. And it's just something I'm really passionate about is I see so many people here with great ideas and they can't hit the ground running. So I just really want to get involved with everybody and find ways to just help people and be like, we've solved this before, we've seen this a million times. Here's a piece to make it better, you know?
Awesome. One last call for questions or feedback. All right, one more round of applause for Productable.
Thank you.
Awesome. Just one quick little reminder that we are active on social media. So please refer to this board if you need to look at any of our Twitter handles for presenters as well as for 1 Million Cups. Use the hashtag 1MCDAO, and we check that frequently, pretty much we're on it every second. So we'd love to have your feedback and have you join the conversation there. And then without further ado, we have our next presenter about to take the stage. So everyone please stand up and give another warm welcome for Sunny at MediBookr.
Thank you so much. Good morning. It's an honor and a privilege to be here. I see a lot of giants that I already know, and I thank you for being here for hearing what I have to present. Again, my name is Sunny Nadowski. I'm the co-founder and CEO of MediBookr. MediBookr is an online marketplace for medical imaging like MRI, CT scan. So if you or someone you know try to do an MRI, you might have noticed there's a big price variance in town, from a few hundred to several $1,000s. What's more, there's really no easy way to capture the price, quality, location, and availability other than calling them one by one, kind of like a hotel industry, travel industry 15 years ago, which wastes a lot of time, especially in today's environment where our healthcare insurance moves from maintenance-based to catastrophe-based with high deductibles, high copays, plus the 25 million uninsured patients. It's really challenging because people have to oftentimes price shop to find what is available, affordable to them. For the imaging centers, they have very expensive equipment, as you know, $1 million equipment. With the shift from for healthcare to value-based pay, bundled payments, they face a tremendous challenge with the rising cost, with the savvy shoppers. They find it very challenging to onboard the patients as it used to be. They suffer from severe underutilization of their expensive equipment. Many of them 50%, 70%, very usual. Many of them only open some days of the week. So we build MediBookr. You wonder how big the problem is. Americans spent $100 billion last year on medical imaging. So we are focusing on the most painful segment, that is the outpatient imaging centers, 19%, which is the $19 billion market. The patients, as I mentioned earlier, we focus on serving those with a high deductible, high copay, or uninsured patients. So on MediBookr, patients can find transparent information on price, quality, location, compare the quotes with appointment times. They can quickly book what is best for them. And the imaging centers can list their price, their services to attract qualified patients, to reduce cost and increase their profit margins. They can quickly offer appointments, book with the patient. They can price up or down their services at any given point of the day based on the utilization of their equipment. As a result, they cut costs, optimize their profit margins. We really help them improve their operations with the analytics as well. So our business model, we are free to patients. We charge the imaging centers a fee, we call the elite fee, 10%, which is about $40, $42 per procedure, because the average procedure is about $420. We also charge them a fee for analytics. Many of them love to have that data to help improve their operation. In due time, we can also generate revenue from advertising. So right now, we are launching in DFW. We have 12 centers paying us for attracting patients, getting the analytics, improve their performance, and patients love it based on the feedback. So you wonder, how do we get patients? How do we get imaging centers? We reach out the imaging centers from the database. We build a complete database of all 314 outpatient imaging centers in DFW. We also onboard them by sending them patients, tell them, the service that we offer and meet with them. With patients, we raise awareness with doctors, with corporate payers, self-funded corporate payers, and strategic partnerships like Southwest Airlines. So recently we won a competition offered by Southwest Airlines to fly to any of the markets that we would expand for free. They also will give us 1 year free media exposure. Last year, for instance, they have over 100 million people flew Southwest Airlines, so they're going to put us in their magazines, on their social media, etc. And of course, the SEO. We have a good Google AdWords ad right now, so if you look for MRI in Dallas, you actually will find us right there. So we meet patients halfway. The team, we have a full stack team. Most of us build successful ventures before. We have the team coming from social media, digital marketing, digital platform, and healthcare. Our plan is to grow in DFW in the next few months and then expand to Houston and the nearby cities from December. In due time, we will expand to other verticals. Our mission is to help improve the quality and efficiency in healthcare. By introducing transparency. If you like what we do, please reach out to me. Together, I believe we can accomplish that mission. Thank you.
All right, we're gonna open it up for questions and feedback. Please raise your hand high. All right.
Hi, my name is Daniel Burdett. I'm curious, where do you get the data for quality? I understand where you would get the pricing data directly from the imagers themselves, but where do you get the data that you call quality?
Sure, thank you. Most of our data came from different sources out there. There are listings of imaging centers. There are listings of different procedures, the cost. There's some of the data are public from CMS, reimbursement rates. And then our data collection team will verify them kind of one-on-one. But when the imaging centers come on board, they give us a list of their services and their prices, especially cash prices. And then we further verify that to make sure it's accurate. But on our website, we list estimated range because, as you might know, contract price are confidential, to third party. But once the patient requests a quote, gets a quote, that data becomes available to everybody else from a data analytics perspective. That answer your question?
Well, so I was curious about the quality part. So you mentioned...
Oh, the quality, for sure.
Okay.
Thank you. Quality comes from two sources. One, from patient reviews. From ground zero, point zero, we get all the written data from Yelp, Google to start with, then gradually replaced by our own patient review. Secondly, when centers list their services, we not only allow them to list their service and price, but also their accreditation, equipment, age of equipment, brand of equipment, and radiologists, their profiles. So that way patients can see both. And there are about 10% of patients looking for quality, and that's why we're doing that. Thank you for that question.
Hi there, I'm Joan Arcero. I guess I need to be educated here. I wasn't aware that I could choose an MRI spot. When I go to the doctor and he says you need an MRI, he makes the appointment for me. So it seems to me that there might be an education piece to the consumers. So what are you doing about that?
Thank you very much for that question. You're right. Many patients didn't know traditionally we didn't have to pay. We just pay $25 office visit and that's it. But today many people have very high deductibles. So many patients are not aware of that. They only found out that, wow, I could have saved $1,000, $500 afterwards, and they become upset. Or when they got to the imaging center, they said, wow, I can't really afford this. They call the doctor back and say, can you send me to a cheaper center? The doctor goes, I'm so busy, I don't know, just go to MediBookr. They have all the mutual information. So what we're doing is we're actually in the process of producing a series of, we call patient orientation YouTube videos, and tell the patients, this is what you can do to help save yourself money. This is what you can do to, you hurt your knee, go get a referral, right? If you got a referral, you don't know where to go, this is what you can do. Or if your doctor just tell you to go to a center too expensive, this is what you should do or what you can do. We are in the process of doing that. So yeah, thank you.
Over here.
Hi, my name's Holly, and I had a little more detailed question for you. So once a patient goes on your platform, how do they then go on to booking an appointment? Is there an online booking platform that you have, or do they have to directly call the center and find out a schedule or a time to book?
Great question, thank you. So as of today, you go to our website, you say, I need an MRI nearby me, and you will see all these transparent information choices in front of you. Based on the quality, the price, the location, everything, you choose what's best, what appeals to you. And then you can request up to 5 quotes. Click, 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 and one more click, and you're done. You just wait for the quotes to come back in. And they come back very fast because they all have designated schedulers to offer you that quote. They're eager to get your business, to get your account. And then you compare them, you say, oh, I really like this one, you click, and you book, that's it. So we offer that for you. And the imaging center will confirm that with you, so you don't have to call anymore. Although you're welcome because you can also message the imaging center as well. Thank you.
Hi, I'm Sharon. How do you know if it's insurance compatible?
If it's insurance compatible.
Oh, sure, absolutely. So when you request the quote, the imaging centers will tell you based on your information. So when you request the quote, we actually ask you, of course it's your choice, but we ask you, are you paying yourself or are you paying with your insurance? If you say, I pay with my insurance, we actually ask you, name of the insurance or just simply what's your number. And then you send the information, the imaging center has all your request details right in front of them, and they give you exactly what's your portion if you were to use your insurance?
We have time for one more question or a piece of feedback. Anybody? All right, our final question. What can the community do for you?
Thank you so much. It takes a village. Every time, people ask me what I do, every time I go to talk about MediBookr, and people seem to like it. We got a very messy healthcare industry, as we all know. It's very broken. Yesterday, somebody made a joke. It's easier to buy a missile or a special gun and know the price in 2 minutes from either Middle East or Eastern Europe or China, but it takes a long time. 45 minutes easy to figure out what's our MRI cost us. So we got a product, and the centers love it, the patients love it, but we need the word to spread around. We need the physicians to know about our existence. I met some physicians, they say, wow, you're the answer to our prayers. But there are 16,600 physicians throughout DFW. We, the patients, are the peers now. Traditionally, it was our insurance. So we need to take control of that. We need to tell a physician, I can't afford that 1,200, 800 MRI. I need to go to a better place. Please just give me the referral and I'll figure out. And tell our friends. Also, I talked about the model. Please let me know that what you think about it, if you think of other ways, or if you know an imaging center or physician, let me know. Any advices about what we're doing, shoot me an email later on. I would really appreciate it.
Awesome. One more round of applause for MediBookr. Thank you so much. All right, before we bring up our last presenter, we also have an exciting new app available for iOS and Android. So if you want to go to the App Store, download it, you can find Dallas, check in, and then also complete a survey that will help provide feedback to our presenters. So it's something fun to do every time you come in each week. All right, so I think we're ready. If you're ready to, go ahead and stand up. Do a big warm welcome for Matt.
We have this pretty big problem in the United States, and it's one that goes completely overlooked. My name is Matt Holland. I'm the co-founder and CEO of Knkt'd Behavioral Health. Over 88 million people in the United States, which is over a quarter of the population, suffer every day with mental health and addiction issues at the cost of almost $231 billion. Which is causing serious problems within the system that I worked in for 16 plus years. As more patients are coming into the system is getting more clogged. We're also seeing lower money coming in the door, higher acuity, and less resources as many different programs close down because they can't afford to run anymore. All the while, the federal government is asking us to meet some pretty serious benchmarks in order to make care more affordable, have better access, and better quality. When you see things like 3 million young adults hitting the system at one time, and only 41% of them actually getting care, that's a serious problem. In steps Knkt'd Behavioral Health. We're proving each and every day with each new client that we bring on board that we are the solution. We help solve many of the systemic problems that are in the system right now. We also help generate more revenue, and we keep providers and patients in contact each and every day. So how do we do that? Well, you sit down with your provider, you decide what it is you want to track. You could track one thing, you could track 9 things. Currently there are 9 modules, and we can add modules at any given time. So eventually, there might be 36 modules. Then you head out the door and go about your day, and we take care of the rest. Knkt'd sends push notifications throughout the day to alert people to answer questions. In the morning, I know I'm going to answer questions about my mood, whether I took my medication, how I slept. 45 seconds later, I'm completely done answering those questions. And then the provider can log on at any time, because that data is instantaneously, almost in near real time, sent to the provider website. We graded on a Likert scale, we color-coded it, so you can just hop right in and see who's struggling. Even if this was 200 people long, those who are having a rough time will always float to the top of the list. So you know exactly who to bring in when you have an empty appointment schedule. Not only that, but it's HIPAA compliant, it's based off of evidence-based practices, and it's bridgeable with all the medical records. So Knkt'd truly is taking therapy and treatment out of the office, in between appointments, and into people's lives. So we hard launched earlier this year, and we bootstrapped this far. We get the word out by going to exhibits, conferences, we do sponsorships, digital and print media goes out the door, but most importantly, the providers that are already using our system are our biggest voice. So everybody wants to know how this system can actually make money. Well, believe it or not, you can build something that works really well, and you can also make a good amount of money from it. Next year will be our first full year, and it just takes 750 clinicians using 15 clients apiece to get over $1 million in revenue, which is only less than 1% of the total market. We already have 4 paying providers in the system, 11 working to paying, and then we've had face-to-face contact with 739 others. We're targeting hospitals, universities, outpatient providers, and private providers. So how do we compare to the rest? Well, at least half of our team spent years working in this system. So we made sure to hit each and every point that the system was having trouble with. But it's important to know that anybody trying to solve this problem in this system gets a tip of my hat. So where are we headed? We have a clear track record where we want to go. By 2018, we'll have pushed out version 3, increasing our price 3 times, which is still more than affordable than the rest of the groups. And we'll also be bringing in 2 more revenue verticals. But it takes true agents of change in order to do this, and this is the amazing team. Our ask is pretty simple. Introduce us to people, investors, partners, and other clinicians. Because the reality is, when 88 million people are struggling on a daily basis, it completely changes the conversation. It's time to change the way we provide care. It's time to be connected.
One more round of applause for Knkt'd. All right, raise your hand high and I'll bring you the microphone. Hi, great presentation. So I was wondering, so you said you have 4 paid right now. So maybe I'm not understanding everything completely, but and you've reached out to over 700. So I'm curious, what is preventing more people from jumping on?
It's hard to do everything. So we have a team that, we have a lot of amazing people that actually help us with this, and they're going to come on board full-time eventually. A lot of people are doing this pro bono because they feel so strongly about the cause. So we have so many people coming in the door. It's hard to get to the ones that we've already met at conferences and other things. So we send out the newsletters, we enter them into the demo system. But then we have to, because when you have a smaller amount of people working, like a skeleton crew, you have to go with the people that really want to get in the system almost instantaneously. And so that's part of our problem. That's why we're raising funds, because we need to bring on 2 marketing people, 2 sales people, and 1 ops person.
How many patients do you actually have using the app out right now in the market?
In the active system, there's about 250. So when I say 4 provider offices come with psychiatrists, they come with case managers, they come with therapists. So it's like a doctor's office. There's lots of different people in that office. Two of the major people that we're bringing on board, we're bringing on 2 major universities and 1 major hospital system on the West Coast. We're going through a SOC 2 Type 1 and HIPAA audit, which is lots of fun, by the way. And so as soon as we get done with that, then we're going to bring those other ones in the door.
Any other questions or pieces of feedback? All right, if you could reiterate what the community can do for you.
Introduce us to people. Anybody. We like to talk to everybody. That's kind of what we do.
Who do you want to get interested? That's kind of big.
Investors, partnerships, and other clinicians and doctors. Because I understand that a lot of where people are getting in the door these days happens to be with family practitioners. So MDs are doing the legwork, and then eventually what they do is they transfer them to a therapist or a psychologist or a psychiatrist. So it's part of the market we're trying to get to right now.
All right, one more round of applause for Knkt'.
All right, so that rounds out our program for today. Feel free, grab coffee, stay, network, talk to everyone. This is why we're here. So thank you so much for joining us. If you would like to get involved with the team here at 1 Million Cups or at the deck, email us at dallas@1millioncups.com. Emmanuel is around. He can give you a tour of the deck if you've never been here before. There he is, waving in the back. But yeah, once again, thanks. Stick around and have a great week and tech week. Thanks so much.